So my topic today is adiposity and brain health. This is an area that I've been researching for now over 20 years. Adipose tissue is a neuroendocrine tissue, as well as in excess contributes to vascular risk. So adipose tissue is a heterogeneous tissue. One of the reasons why it is so influential in human health and disease is because it secretes over 700 compounds. These are collectively known as adipokines. Some of them are listed on the left-hand panel here. One of the reasons why adipose tissue secretes so many different compounds is because it's a heterogeneous tissue. It's not just one compartment, it's not just one cell type. So adipose tissue is comprised of a stem cell population. It contains a stromal layer, which is predominantly pre-adipocytes. Once pre-adipocytes are activated by hormones, right, they accumulate fat and they become these nice round droplets, as you see in that compartment at the bottom. However, not all of these droplets are white. Some are beige, some are brown because of differentially amounts of mitochondria for the most part. And that creates differences in energy metabolism as well as their neuroendocrine action. Finally, adipose tissue, as we all know, tends to distribute differently in different people. Some people have central obesity, some people have more fat in their thighs. In addition, and in their hips, in addition, inside the body, there are different adipose depots. So we talk about subcutaneous fat, visceral fat, etc. Looking on the right-hand side of this particular diagram from the bottom, what's indicated here is that overweight and obesity does contribute to a vascular cascade, right? It increases risk for hypertension, type 2 diabetes, cerebral cardiovascular disease, all of which, when measured during middle age, influence the risk for late-life dementia. However, we also observe an inflection point in body weight during the adult life course at around age 70, and people do tend to start, on average, losing weight or losing BMI. This was also shown by the Alzheimer's disease neuroimaging clinical cohort, where they showed in the brown line at the very top that vascular abnormalities appear first and remain most persistent in relationship to the development of Alzheimer's disease. And this is going to be featured at the Congress, Alzheimer's Association International Congress in July as a pre-meeting. And of course, there are societies like VASCOG, which make that their mission to understand the role of vascular risk factors in late onset dementias. So my experience in adiposity and brain health has spanned the neuroepidemiological space. I do not do basic research. I've worked with a variety of different clinical and observational cohorts, as well as done some pilot studies, and worked primarily in North America, South America, and Europe. And so I'm going to share with you some of these results today, very briefly. So in the top left-hand panel, you'll see our first ever report showing that being more overweight actually increased risk for Alzheimer's disease. This was kind of an anomaly report, although it was very popular at the time, and this was being more overweight at age 70 increased risk for Alzheimer's disease at age 80. That has not been replicated so often. However, people have moved forward and explored looking at middle life or mid-age obesity in relationship to late life brain health. And what most data suggests is that if you have a central obesity and or are obese at middle age, you are at risk for later onset dementia. In these data from the prospective population study of women, we showed that central obesity during middle age was associated with late life dementia, and that the ApoE epsilon 4 allele, which is a risk allele for Alzheimer's disease, was associated actually with this BMI decline or body weight decline, whether or not someone went on to develop dementia. We went on to replicate similar aspects of that in the National Alzheimer's Coordinating Center database, and we found that among those individuals as a clinical cohort who were at least age 65 at baseline, those who were a little bit had higher body weight and lacked the ApoE4 allele progressed more slowly to the development of Alzheimer's disease. And finally, in the lower left-hand corner, we looked at the role of overweight and obesity in relationship to mortality in an Italian cohort. These are adults at least age 70. They live in a long-lived region of Italy, Treviso. And we looked and saw that if people were underweight at age 70 or older, they tended to die more quickly, basically, and that was pronounced among people with lower global cognition, which is the left-hand panel versus the right-hand panel that was measured using the mini-mental state examination. Finally, bringing the data more close to home, we've been evaluating some of these same associations in the Max-Wise combined cohort study, for which Brooklyn has been a site for over 25 years. And in the upper left-hand panel, what you'll see is that in a study of men, we looked at the role of overweight and obesity in relationship to decline or change in neuropsychological performance, and we found that it was in HIV-negative men that, in fact, the obese phenotype shown in the blue line was associated with greater decline in neuropsychological performance over an approximate 8-year period. And this was not observed in the HIV positive men. So this has led to a variety of different hypotheses about why this might occur. And then in the upper right panel, we've been able to look at change in leptin and change in BMI in the women in the cohort between the average age of 38 and 48. And what we've shown is that a greater change or increase in leptin and BMI, indicating increasing in obesity or overweight, increasing adipose tissue over time, did lead to lower associations with lower neuropsychological performance at follow-up. And notably, this was an analysis done by one of our own medical students, Francesca Macaluso, who recently graduated and is on her way to residency. And finally, in the lower panel, I've been looking at the influence of adiposity-related measures in a cerebrovascular small vessel disease cohort. So this is a very special cohort. These are people who are clinically diagnosed with CSVD. And we've shown differential associations between anthropometric and metabolic factors, notably leptin, in association with brain volumetry as well as vascular outcomes, such that higher BMI or higher waist circumference or higher leptin levels are related to lower brain volumes. And most notably, over a 9-year follow-up period, those people with central obesity, the men had declining hippocampal volumes, and the women and men increasing white matter hyperintensity, since this was done with the 2 repeated MRIs. So that's what it denotes this change variable. And then finally, I wanted to share a little bit about some of the things. The top 2 panels are just basically exploratory pilot data that we've collected in the Southwest U.S., both in the Albuquerque area and the Tucson area. And I'm just providing that as kind of background data for those of you who might be interested in indigenous communities. And most notably in these particular Indian communities, they do have a high risk, it's a convenient sample, they do have high vascular risk, obesity, hypertension, but at the same time, they're actually doing pretty well cognitively, relatively okay in terms of depressive symptoms and a high level of mastery. And then, fat isn't only in our body, fat is also in our food. So I thought I would throw in one dietary analysis that we did with the Washington Heights, Inwood Heights, and Hamilton Heights Columbia Aging Project on the Upper West Side, where we showed that increasing intakes of omega-3 fatty acids, notably DHA and EPA, were actually associated with the lower Alzheimer's disease risk and greater dementia-free survival. So in summary, I would like to also mention that overweight and obesity are not only associated with risk for later onset cognitive disorders, but are also associated with other neurological outcomes. So obesity has been shown to be a risk factor for migraine, for peripheral neuropathies. It affects the progression and or severity of multiple sclerosis and Parkinson's disease. And it has been shown to be protective for Huntington's disease at late onset Huntington's. This is a disease that's characterized by body weight loss. So adiposity is going to continue to be a challenge for neurology, both from a research perspective, but also from being in the clinic and how we work with our patients. Not my patients, but your patients. And so it is the shape of things to come. Thank you.